Morning.
Morning.
Hi, good morning. Welcome, everybody. We'll go ahead and get started with the Vitalyst Health Foundation Systems Change Grant information session in just a couple minutes. Good morning, everybody. Welcome to the Vitalyst Systems Change Grant information session. We'll get started in about a minute or so, just to let folks settle in. Great. Good morning, everybody. Thank you so much for joining us for the fiscal year 23-24 Vitalyst Health Foundation System Change Grant information session. My name is David Martinez, a director at Vitalyst Health Foundation. I can't believe it's already the time to reopen our system change grant cycle again, but I hope everyone has been enjoying their rather toasty summer here in Arizona, wherever you are across our great state 48. We are excited to be able to once again open up our system change grant cycle and have host this information session to review the information about that grant criteria and the process to apply. Just a couple of housekeeping notes. I'll toss it really quickly to my colleague, Virginia.
Hi everyone, buenos días a todos. Somos bilingües, así que si alguien necesita ayuda con una aplicación en español, por favor escríbenos al correo que está en la pantalla. That was a message in Spanish. Good morning to everyone. We are bilingual, so if any of the organizations here need help with an application in Spanish, please feel free to email us in the email on the screen.
Great, thank you so much, Virginia. We also have closed captioning available, so you'll see that option as part of Zoom to be as accessible as we can to our partners throughout the state. All lines should be muted, but feel free to put your questions into the chat box. Introduce yourself into the chat box as well. Our team will be answering those live through the chat room, and then we'll have a live Q&A as at the end of the information session. All of the materials will be posted to our Systems Change Grant webpage at vitalysthealth.org. So that includes the frequently asked questions that will be answered live, but we'll be recording those and posting that document, the slides that I'm currently reviewing through PowerPoint, and the recording so folks can view it at their leisure throughout the next couple weeks. As I mentioned, I'm David Martinez. I oversee our capacity building and grants program here at Vitalyst Health Foundation. It's been great to serve at Vitalyst for almost 5 years now, and we've gone through a lot of staff and work reconfigurations over the past couple years, just like a lot of organizations. We're really excited to continue to deepen the relationships that we have with partners across our states. Many folks know my colleague Kelsey Yatton, who is our Assistant Director of Partner Engagement. As part of that staff reconfiguration, we hope to deepen partnerships that we have with our grant partners, as well as our fiscally sponsored projects through TAP-AZ. We have also strengthened our team to be a bit more trust-based philanthropic organization, including our learning and evaluation with partners. So our existing partners have gotten to know my colleague, Virginia Becerra de Meneses, who leads our evaluation work. And then newer to our team is Michelle Goodthunder, who is our program manager for grants and partnerships. So a lot of folks that are initially exploring and discovering partnership with Vitalyst get a chance to engage with her, and she's been providing great support to our programs team here at Vitalyst. We are open and accessible, so you'll learn how you can easily discover partnership with Vitalyst in just a few moments, but you see our email addresses on this slide as well, so don't hesitate to reach out to us if you have any questions after this information session or throughout the next year. A lot of folks know about Vitalyst Health Foundation, but just as a broad overview, our vision is that all individuals and communities in Arizona are healthy and resilient. Our mission is three-pronged. We hope to connect, support, and inform efforts that improve the health in individuals and communities throughout the state of Arizona. And we do that by executing along three goals. We work upstream towards policy and systems change, hence the systems change grants, and we know that takes a village. So a lot of our efforts are supporting those collaborative networks, coalitions that are working to improve the conditions that impact health. But we also recognize that those individual collaborative networks are made up of individual community partners. We want to ensure that those partners are strong and equipped to advance health equity. So we focus on that effort as well. And because we do focus on policy and systems change, we want to continue efforts to inform decision makers and ensure that they prioritize community health and well-being. So each of those three goal areas, we have activities focused on each of our three priority areas that are more programmatic side of the house of Vitalyst Health Foundation. So beyond just our responsive grant making program, we have directors that oversee priority portfolio areas around what we call civic health, healthcare integration, and housing. Obviously, these three topics are really critical to the state right now. I'm proud to lead our civic health efforts. We'll have a new director come on board as to oversee our healthcare integration work, which is the integration between physical, mental, and the social determinants of health. And of course, our critical efforts around access to care and coverage. And then obviously throughout the state, we know that housing, the entire spectrum of housing is a really big issue. So my colleague, Gabriel Jaramillo, directs our efforts around housing, and definitely recommend you check out all the great work happening in that space. We have an open door policy here at Vitalyst. So even if you don't fall within those three priority areas, we're willing to discover partnership with you. We have, over the past couple of years, reconfigured not only our staff, but our work. So all of our partnership opportunities are explored through this discovery process. And it's meant to just connect you all a bit more strategically with the partnership opportunities that Vitalyst has. And through that discovery process, you're connected with a Vitalyst team member that can best and most appropriately connect with you and your mission, your needs, so that we can identify what partnership opportunity may be the best for you and your organization. So we'll talk a little bit more about that discovery process in just a little bit. But that process enables you to explore the various types of partnership opportunities we have at Vitalyst. Beyond just our programmatic work in those priority areas, we have responsive grant making program. The Spark and Systems Change is what we'll talk a little bit about, not a little bit, we'll talk a lot about today, focus on, again, that policy, systems, and environmental change that has been a niche that Vitalyst has been following. We have capacity building grant support as well, our technical assistance grants to build up the capacity of individual organizations, and then our advocacy and public policy grants. Because we do work towards policy and systems change, we want more nonprofits to engage in this space as well. So if you're mission aligned, and if you're aligned with our policy and legislative agenda, we can leverage capacity building support to boost your own capacity for advocacy and public policy as well. We also have our medical assistance grants, and I'm proud that we have just closed that grant cycle, and we'll be introducing our new class of medical assistance grants partners that are doing tremendous work here in Maricopa County to serve low-income and underserved populations in the key areas of vision, hearing, heart and lung, and substance use. So you'll be meeting those grant partners soon. As many of you know, Vitalyst is a health foundation, but we see health as more than just health care. We see the social determinants of health, or what we call the elements of a healthy community. This is the will that reflects those elements of a healthy community. So all of these indicators really impact a person's ability, our community's ability to live healthy and productive lives. We, of course, hold a health equity lens in all of the work that we do and want to build and sustain the resiliency of our people in Arizona and our communities. A big aspect of the will is the intersectionality between these elements, so that we see health as more than just healthcare. We see housing as healthcare. We see food insecurity as healthcare. So a lot of the work of Vitalyst is done in the middle, in the center of this will, to show that health intersects with all elements of a healthy community. So our Systems Change Grant is one way that we work to improve the health of people and communities throughout the state of Arizona. It's one tier of our two-tiered grants meant to catalyze collaborative work that transforms those systems through changes to policies and practices that ultimately improve the health of our communities. They are a 3-year grant of up to $175,000. This fiscal year, we once again have 4 grants to award, funding for up to 4 grants. So we are excited to have this 2-tiered grants program and implement it now for several years, and have had great success with some of our existing system change grant partners. And we'll go over the process now. We are hosting this information session, and it's recorded and we'll be posting it. The online portal to submit the initial letter of intent will open up on September 1st. But again, you can go through that discovery process to explore if it's a good fit, if the System Change Grant is a good fit for your collaborative network. While the online portal is open on September 1 and our discovery intake now is open, so we can discover if it's a good fit or not, the ultimate letter of intent is due on October 6th. So that's the big deadline that you'll have to pay attention to. So by October 6th is when you'll submit your letter of intent. That's the first step of our application process. Our internal grants review team, which includes Vitalyst team members and board of trustees, will review those letters of intent and then invite a select few to submit full proposals. That'll happen by December 11th. And folks will have from that date until January 19th to submit a full proposal. That application is complemented by a presentation to our grant review team, which again includes Vitalyst team members and Vitalyst board members. That'll happen that week of February 5th through the 9th. And then we continue our internal grant review process and ultimately make a recommendation, and our board approves the up to 4 system change grant partners, and we make those award notifications on March 25th. The System Change Grant has 6 criteria, and they are encapsulated in this slide. So the System Change Grant that Vitalyst has are meant for collaboratives that are working towards systems change, towards a specific health outcome that holds a health equity lens. The budget proposed is to match the scope of work towards that systems change, and the system change effort should be a sustainable solution. So those are overall the 6 criteria of the Vitalyst Systems Change Grants, and we'll take a deeper dive into what we mean by each of those criteria. We know that policy and systems change takes a village, and it's important that because of that, the effort is a collaborative network effort, a coalition of stakeholders that are coming together to foster that cross-sector integration, that collaborative is deep, that they have, they're well established. They have identified the intervention or solution towards systems change. They just need multi-year funding to help get it through. So the collaborative network is a really critical piece of our systems change grant criteria. The specific points that you see on this slide and each of the remaining slides of each of the criteria are really important to keep in mind, because this is essentially an open book test. The specific points that you see on this slide are the exact points and questions that our grant reviewers are asking themselves when reviewing your proposals. So long as in your letter of intent and perhaps in your eventual application, you answer these specific questions, then your proposal will be that much stronger. So these 4 specific points under the collaborative criteria are the exact same questions that our grant review team are assessing your proposal. So the lead applicant for the collaborative has to be an Arizona-based nonprofit that's serving Arizonans. Fiscally sponsored organizations are okay. The lead applicant can also be an institutional partner, like a government institution or college or university, and we'll take a little bit of a deeper dive on that in a little bit. The collaborative must be 2 or more community partners that are clearly identified, and their specific roles in that collaborative must be identified as well. This is really important factor because it's not just folks that are endorsing the effort, they are playing a critical role in the collaborative, in the coalition towards systems change. So that's where that 3rd point, the characteristics of the partnership as described above, are adequately reflected in a letter of intent. So each of your collaborative partners, or at least the core partners, have specific roles towards your systems change, and that should be reflected in your letter of intent. And then we evaluate whether the lead applicant and the partners have the experience to propose a system change for the identified population. And this is a really big piece, especially connected to the health equity criteria. Those closest to the problem should be closest to the solution. But we want those that are leading the effort and that are part of the collaborative network to have some sort of expertise to be able to advance the system change forward. So again, if your letter of intent covers those 4 specific points, answers those 4 questions, that will make your proposal that much stronger. The collaborative should, of course, be working towards some sort of systems change. These are systems change grants, so we want to support some sort of policy, systems, or environmental changes. These are really transformative efforts. Systems change really change the conditions that are holding the problem in the place. They are tackling in an upstream fashion the root causes of the problems. And this could look like a lot of different things. Systems change looks like a lot of different things. It could be shifts in resources and services, a more relationship-based movement, values or perceptions, a mental model is shifted. So system change can mean a lot of things besides just policy or practice change, and we'll dive deeper into that in a little bit. But it encompasses these specific points as far as we're concerned for the criteria. So your letter of intent submission should be focused on the proposed systems change and that it is as clear as possible. And that is really helpful, especially when your systems change is not a policy or practice change, because sometimes when it's not as easily seen as like a state law or a city ordinance, when it's the other types of systems change, it's a little bit harder to really define or see. So it's really incumbent upon you to ensure that that focus is as clear as possible. The systems change should address the root causes or barriers to healthy communities. So again, reflecting on that will and going to the root causes of the disparities or challenges within those elements. And the systems change effort is really focused on that transformational, relational, or structural change. And we'll show you a really great visual to showcase the different conditions of systems change that can help frame your answer to this point. The proposed system change should be doable. We're not shy around collaboratives taking risks and tackling some really tough challenges that we're experiencing here in Arizona, but the proposal should be feasible. We are, again, not shy from big, hairy, audacious goals, but we really evaluate whether or not the proposal is feasible and at the very least can make some substantive advancement towards that systems change. We know systems change takes several years and perhaps even beyond a 3-year grant cycle. But if we see proper or good progress towards your systems change, we see that as valuable as well. And then your letter of intent covering the system change criteria should just be as clear as possible when you prescribe the specific intervention or solutions that you have towards your systems change effort. So what do we mean by systems change? We've gotten a lot of feedback from past applicants and partners that want us to do a better job with defining what we mean by systems change. So if you visit that website that's linked on this slide at vitalysthealth.org/grants/system change grants, you'll find a lot more resources that we've compiled to identify and help folks see what we mean by systems change. But I love this visual because it showcases a lot of the different changes possible, whether they be structural, relational, or transformative, right? That whole mental model, changing hearts and minds, is a systems change. Harder to define and see, but not impossible. And we'll showcase a couple of examples where we have funded that as well. But again, the systems change goes beyond just policy and practice changes, though again, those are definitely supported by us and easier to showcase. But systems change can include that structural change of resource flows, or that more relational change between relationships and connections, or shifting power dynamics. And again, that transformative change of systems change is changing the hearts and minds, and that's the mental model condition of systems change. Here's another visual that we often use in showcasing what we mean by systems change. So again, we follow this upstream approach to tackling or improving health. You see this a lot in public health, and when folks are talking about the social determinants and social needs of improving health. So this is a really unique niche that Vitalyst fills, focused on upstream approaches and strategies that are improving community conditions. These tactics often include some sort of policy, systems, or environmental changes. So that's really what the grant is meant to support, the upstream approaches to improving health. If your effort is more midstream or downstream, there will likely be misalignment with our systems change grant efforts, especially if your efforts are more focused on those downstream strategies that are providing direct service, programmatic work, in this visual, providing clinical care, the more medical interventions that are very important in our communities. But we, again, want to focus on those upstream approaches to improve health, the policy, systems, and environmental changes. One of the ways that we have showcased what we mean by systems change is by profiling some of our past and current system change grant partners through our podcast. My colleague Sergio Perez, who directs our strategic communications, has done a great job with profiling through a systems change series in our podcast and in our communication channels, the great examples we have and are supporting towards systems change. They include efforts that have indeed changed policy and practices, like our great partners at ASCHOW, or the Community Health Worker Association, that changed state licensing practices to ensure that community health workers can indeed be licensed and their work be reimbursed through Access, our state Medicaid system, which obviously through the pandemic we saw as a critical need and service that is now able to be supported. We have a great team up in Coconino County led by Virginia Wadahumuji to really transform a trauma-informed community, working with the city of Flagstaff and Coconino County to ensure that a trauma-informed lens is made in a lot of their decisions and government implementation of government services. So this is a great example of not necessarily a policy or practice change, though that might be included as part of their efforts. It's really trying to infuse this concept of trauma-informed community practices. And that trauma-informed practice is something that we've seen in a lot of our grant partnerships as well. Obviously, mental health is a really big issue, especially coming out of the pandemic. And we have a long-standing history of supporting those efforts, including trauma-informed school systems, especially working with a great organization, South Mountain Works Coalition, which is another great example of where it might not necessarily be a policy or practice change. There are other systemic change or environmental change that we've supported as well. So definitely check out our podcast and learn more about successful system change efforts that we're supporting. So our third criteria around our system change grant, it has to be a collaborative working towards systems change to improve some sort of health outcome. So this is the mission alignment question that we ask ourselves. So you saw Vitalyst mission earlier to connect, support, and inform efforts that are supporting and improving the health of the population here in Arizona in our communities. So that's definitely a key aspect of it, the direct health outcome, and then the intersection of the elements of a healthy community will. Both of these aspects are really important because we know that access to care and coverage, the actual health outcome is still a very important aspect of living a healthy life. So the direct health outcome is really important, but also that intersection between those elements of a healthy community. So definitely reflect on that will, and our website, vitalysthealth.org, has a great handbook that details a bit more comprehensively what how we see each of those elements. So these specific points are the questions that our grant review team are asking ourselves when we're reviewing the submissions and seeing how your health outcomes, how your proposal advance health outcomes. We want those to be really clearly identified and framed in health disparities language. We know that, especially because of the pandemic, a lot of health inequities were exposed. So how are your efforts advancing positive health outcomes in especially tackling health disparities and health inequities? Your specific population should be clearly identified as well. The more specific and the more focused you are is really important as well. We know a lot of policy and systems change happens at the statewide level, but if you clarify the specific population, especially holding that health disparity language lens, will strengthen your proposal as well. The systems change improves the identified health outcomes. So again, just being really detailed and clarify that piece. And I can't stress enough the intersectionality between the elements of a healthy community will just strengthens the effort towards systems change. It's just not one spoke of that will, it's the intersection, or again, that middle. So the better you can clarify that in your submission, the stronger your proposal will be. So obviously we see health is more than just healthcare. We know that there are a lot of non-medical factors when it comes to individual and population health. This is another visual that reflects that, yes, healthcare is important and impacts health behaviors, but things like the physical environment and other socioeconomic factors determine a person's ability to live a healthy and productive life as well. And again, we rely heavily on the elements of a healthy community will. And again, not just an individual spoke of this will, but the center, the intersectionality of each of these elements. And if you go to that link posted on this slide, you'll see a greater handbook that dives a little bit deeper into each of the elements of a healthy community. So if you don't necessarily see your particular effort, collaborative effort in one of these or named in one of these elements, check out that handbook because you might see it a bit deeply reflected in the elements, but again, focus on the intersectionality. We've also worked the past couple years really closely with the Intertribal Council of Arizona and a great network of tribal leaders to redesign the elements of a healthy community wheel to better reflect the elements of a healthy tribal community. So this is the new tribal wheel and new materials that better reflect those elements and the social determinants of health reflected a bit more culturally competently for tribal communities, our sovereign nations here in Arizona. So if your efforts are focused on tribal communities, that specific population, then this might be a great resource for you to strengthen your health outcomes criteria portion of your submission. The next criteria of our system change grant is focused on holding a health equity lens. So the health equity lens is a really important criteria for us because it's something that we practice, a lens that we hold in all of our work at Vitalyst as well. We want to ensure that those closest to the problem are closest to the solution, that specific populations, again, with that health disparity language are identified. So this criteria of our system change grant is important to us, and your proposal should reflect how your efforts are holding a health equity lens in your work. Again, that a great assessment that we see in that we use in reviewing the health equity criteria is by you showing that those that are being impacted by the change that you're looking to make are at your table, are part of your collaborative network, including having a tremendous influential or decision-making role. So those closest to the problem are closest to the solution. This is really important too. As I mentioned, lead applicants can be institutional partners like government, like colleges or universities, but your application will be so much stronger if through this health equity lens, the collaborative network is led, or there are community partners that hold this equity lens, and those community-centered perspectives are adequately reflected in your collaborative network. So while we have awarded and will accept applicants that are institutional, we really behoove you to really have those that are most impacted by your effort to lead the effort. We really follow that community-centered approach really strongly. The proposed systems change obviously should be impacting that community that you're focused on. This is again also reflecting on the health outcome criteria, that specific population being identified, and your efforts should be culturally relevant. And by engaging the community that is being impacted by this effort, that'll help you ensure that your efforts are fit that specific point as well. Another visual that reflects better what we mean by health equity. Equitable practices go beyond just equality or providing equal services. It's really meeting people where they're at and ensuring that the resources, the services, the efforts that you all are supporting are a bit more equitable and follow that lens. The fifth criteria of the Vitalyst System Change Grant is that the budget that you propose as part of your system change effort should match the scope of work that you're anticipating. So this is a 3-year grant of up to $175,000. So the budget that you submit as in the narrative as part of your proposal should reflect how you are using those funds towards your systems change. Obviously, systems change takes a village. It takes multi-year funding. Maybe $175,000 won't help you accomplish your complete systems change, but in your proposal, how will this 3-year grant of up to $175,000 help you achieve your systems change or make good progress towards your systems change? This criteria also outlines what is our allowable expenses for our Vitalyst Systems Change grants. This funds aren't to support capital expenditures or improve long-term capital assets. Vitalyst as a foundation doesn't support capital like buildings and other kind of more kind of long-lasting assets that an entity might have. We do allow funding to go to for-profit entities and for lobbying expenses, but we would love to have a conversation with you just to make sure that you are on the up and up on all of those fronts. And there have been past systems change grant partners that have leveraged some funding to cover the cost of for-profit entities, private entities as well. So this criteria is really just focused on ensuring that the requested funding is really consistent with the grant amount, that it is within the proposed scope of work, and that your narrative, the budget narrative, just better reflects what the actual numbers are as part of your budget. The proposal, again, should obviously only be for allowable expenses. And then the last criteria is around sustainability. And while it follows the budget criteria, this isn't at all related to the financial sustainability of your project or your efforts. A true systems change effort is sustainable in itself. It's a sustainable solution that should endure beyond the grant period. So when I'm talking with prospective system change grant applicants, this is an important question that I ask them, because if your effort needs funding beyond the grant period, if ongoing funding is needed for the effort, it's likely misaligned with the systems change efforts. Once a systems change happens, it's done. It doesn't need additional funding. There might be some residual work that needs to happen, but the best example I have of this is a policy or practice change. So when a law changes, it's done, and hopefully the good has happened. Or we might retract the law, right? And the good will happen because of that. Or a city ordinance is passed, or a state regulation or federal rule is amended. And then the systems change is done, and hopefully we're reaping the benefits of that effort. Again, there might be some residual like rulemaking or whatnot, but the sustainable solution itself is complete and endures after the grants period is ended. Ongoing funding isn't needed. So the criteria, the specific points that you should focus on in this criteria is to encapsulate that, to ensure that the sustainability of the solution is there, and that the work it's done in the context of the work, that it is focused on that particular project, and no ongoing funding is needed. Again, that would be a bit more direct service or programmatic in nature. And then the sustainability aspect of specific point of the health outcome addressed by the proposed system change will be sustained after the grant ends. That's the good, hopefully, that comes with the policy, systems, or environmental change. So the sustainability, again, is more so about the systems change being a sustainable solution, and not the sustainable financial or funding needed for the effort. So just to capture it all in one slide again, there are 6 criteria for the Vitalyst systems change grants. They are meant for collaboratives working towards systems change, towards a specific health outcome with the health equity lens. The budget should be reflect scope of work, 3-year grants of up to $175,000. And the effort should be a sustainable solution, a sustainable system change solution, and not necessarily a sustainable funding needed for the project. So those are the 6 criteria of our systems change grants. So if you're thinking, all right, I think our collaborative is meeting those 6 criteria, we're ready to begin drafting our letter of intent. That's the first step of the application process. But we are open to having conversations with folks that still have questions or are not sure if the effort is completely a systems change effort. And this is just to be open and transparent. At Vitalyst, we try to practice trust-based philanthropy. And so we would rather have this upfront conversation with you, determine if you actually meet those 6 criteria, or if it can be strengthened in any way before you begin drafting the letter of intent and then submit it. Folks are welcome to submit the letter of intent even without having these conversations. They're completely optional, but we do make ourselves available, and you can do so by completing that discovery intake form at vitalysthealth.org, and the grants and partnership page you'll see there. Just select you're interested in a systems change grant, and then from there you'll receive a separate email to prompt you to schedule a time with a Vitalyst team member that can better address the questions or your proposal. We highly recommend this if you are considering about applying, because we would rather have these conversations again up front to see if it is indeed a system change grant effort, that it meets the 6 criteria, so that you don't waste too much time or your time drafting, even though it is just a 2-page letter of intent. We want to ensure that your proposal is as strong as possible. So we're open to having those conversations now. The online grants portal to submit your letter of intent will open September 1, and then folks have until October 6th to submit their letter of intent, and those submissions are made through an online portal that's linked on this slide. So we have created a document that is a how-to guide. If you have any questions about how to submit that letter of intent through our online portal, so this will be posted on the slide. This is posted on the slides, and then again in the FAQ. Your letter of intent is up to 2 pages. Type single space, minimum of 12-point font in traditionally used fonts. Don't go too crazy with your 2 pages, keep it to 1-inch margins, and we accept, our online portal accepts those, that variety of file types, PDF, docx, text, JPEG, or PNG. If you have any questions about your LOI, beyond just going through that discovery process, feel free to submit questions, especially as it pertains to the online portal and submission assistance. Feel free to email grants@vitalysthealth.org. So that covers the system change grant, the 6 criteria for those collaboratives that know their intervention or solution towards systems change. They just need multi-year funding to help implement it. If you are listening to this information session and thinking, I'm not quite sure if we're there yet, then perhaps the Spark grant is the better option for you. The Spark grant, again, is part of our 2-tiered grant program at Vitalyst that focuses on policy or systems change. So beyond just the 3-year grant of up to $175,000, which is a systems change grant, we have a 1-year grant of up to $25,000 that's meant for those efforts that maybe the collaborative network isn't quite as formed up as it needs to be to apply for the larger systems change grant. So you just need a 1-year planning grant essentially to form up that coalition. Or even if you are formed up as a collaborative network, you haven't quite identified the specific intervention or solution towards systems change. So again, you need that 1-year planning to do so that maybe next year, the following year, you're in a better position to apply for the larger systems change grant. So these grants, again, are a 1-year grant of up to $25,000 meant to spark the concept towards systems change. We have funding to award up to 8 of these in this fiscal year. And we explore these throughout the fiscal year. So if you think that you're not quite ready for a system change grant and the Spark grant might be a better option for you, complete the discovery intake process, as I mentioned there, on our vitalysthealth.org website, and select you're interested in a Spark grant. And then our team will have a deeper conversation about you to see if the Spark grant is indeed the better option for you. We will review those opportunities throughout the fiscal year. And as we see that those efforts are indeed well suited for a Spark grant, we go through our internal grant process here and advance those for our board to approve on a quarterly basis. So if you go to vitalysthealth.org, you'll see the specific quarterly timeline that we have. But again, we're reviewing those throughout the year at our vitalysthealth.org website and the grants and partnerships webpage. So that covered a lot in a short amount of time, but if you have any questions, feel free to visit our website, give us a call at 602-385-6500 or reach out to any of our team members for any specific questions. Of course, go through the Vitalyst discovery intake process if you want to have a deeper conversation about your proposal and how we might strengthen it or determine if it's the best fit or not. So for now, I will stop sharing so that we can have a live Q&A session, but initially we'll toss it over to my colleague Kelsey, Virginia, or Michelle if there were any specific questions from the chat room that we might want to raise up for the whole group here.
Yes, David, we have a few questions. Would you mind providing a little bit more of clarity on lobbying expenses and what is being allowed and what is not?
Yeah, this is a great question. I think we obviously policy and systems change often includes lobbying expenses. I think what we especially just want to ensure is that the entity that would be leading those lobbying efforts is able to follow the specific rules towards lobbying. So there are specific rules that allow, especially nonprofits, to engage in lobbying, but those rules have regulations, and we don't want our partners to be in a position where they fall out of those regulations. So it is allowable in the true kind of nonprofit lobbying regulations, but we just want to have a conversation to see if the organization that is, again, leading those direct lobbying or the grassroots lobbying efforts are able to do so and assist you in walking through that process.
Awesome. Thank you for that, David. We have a few other questions. Do statewide initiatives receive preference over regionally focused initiatives?
Great question. There is no preference for statewide or more regionally. But again, if you think through those criteria, especially the health outcome where you identify a specific population, that is a specific point that our grant and review team is looking at. So if you're a statewide issue, you should be looking at a specific population and a clearly identified population whose health outcome you're trying to improve. So say if you just frame, I want to improve the health of all children in Arizona, that's pretty broad, and we would want you to be a bit more specific, like what children, where are they, what specific health outcome. So as focused in on that particular health outcome will strengthen your proposal. Also, again, holding that health equity lens and framing your efforts around that health disparity language will help as well. So I think the answer to the question about preference is no, and just reflect on those specific points in your criteria.
Thank you for that. And one more question. Since there is a large number going for the award and only 4 awards, will Vitalyst connect entities that are going for the same systems change if they opt in?
Great question. If we find partners are going towards the same system change efforts before the letter of intent is submitted, we try to forge those connections as much as possible. And even there have been some instances in the past where 2 or more entities might be tackling the same system change efforts. We'll make kind introduction and say, hey, it might behoove you to work more collaboratively together. But we have advanced similar efforts through the application process. And then our grants review team reviews the criteria and those specific points to see which effort might be better suited or better equipped to tackle that. Especially if the conversation is held before in the LOI submission, or perhaps even after. We always promote the great resource called the Arizona Together for Impact Fund, which supports nonprofit collaborations. And that can look like a lot of different types of collaborations, not just mergers and acquisitions to nonprofit organizations becoming one, but there are other types of collaborations like joint programming, shared support functions that are supported as well. So we support as much as possible, we promote as much as possible opportunities for entities to collaborate together.
We have one more question that we answered, but we want to know your input about this.
Okay.
So what kind of experience are you looking for with the lead applicant?
What kind of experience? for the lead applicant. I mean, I think that can look like a lot of different things, but I would say we kind of would use our common sense, or if we know, especially because we have a wide diversity of backgrounds and experiences, both with the Vitalyst team and our board members, and our extended community partners that might be subject matter experts. If folks are seen in the community as experts or leading those efforts, then yeah, it would make sense for them to apply. If it's a bit more questionable, we do a little bit of research on ourselves as well. We might ask some of our partners that have a subject matter expertise in that area. But again, it really behooves you in your proposal to show how you are the expert in that area as well. So the measurement of experience kind of can run the gamut, but the greater that you can explain your leadership and expertise in that specific effort, the better the proposal will be.
Thanks, David. That's it for the questions that need to be answered, but I don't know if anyone else has another question, feel free.
Yeah, feel free to continue to ask questions in the chat room, or we can also unmute you if you want to ask your question live. All right, I think we might be good with questions and answers now, but we have an open door policy. We are very accessible. We want to be able to answer your questions one-on-one. So feel free to go through our discovery process if you want to have a deeper conversation with the Vitalyst team member to have those more specific questions answered. Or if you just want to kind of vet the idea towards systems change to see if we think it might fit within the criteria of our systems change grant. So don't hesitate to reach out to us. Thank you again for all of the great work that you're doing throughout the state of Arizona to improve the health of our neighbors and our state. Keep in touch with Vitalyst. We have clarified what we mean by system change as much as possible, and we'll continue to do so at vitalysthealth.org. Thank you so much, everybody. Take care.